So I believe it's just on me now to close out the day. I'm not going to hold everybody very long, but I'm going to start with gratitude. I really want to thank the HDHI team for helping to orchestrate such a fantastic day. I certainly think it's been a fantastic day, so thanks to the team. Thank you to the Smith Center staff, and thanks to our AV team as well. And of course, thanks to you, our guests. Thanks for staying here all day with us. Thanks for flying from various parts of the world. Thanks for Zooming in to the webinar. We couldn't have this convening if people didn't come. So thanks for accepting the invitations to do that. I found myself really unable to do any summary of what we've talked about today, but that's partly the point. The theme was partnerships in action. And I think through this real diversity of perspectives on what that means and on what the various challenges we face to achieve health equity, to achieve health for all, we've had so many pearls of wisdom and challenge to us. And we've gone from, you know, technical and tactical discussions on what we could do now and what we could do today to conversations about power and positionality, accompaniment and what that means really filtered throughout the whole day and echoed a lot of our dear colleague, Paul Farmer, and what he always taught us and reminded us to do, and what accompaniment means, as Dr. Walton said, and quoted Dr. Farmer about walking with somebody for a while and not a short while. And how do we embody that in our work? And how do we grapple with these challenges of the fact that, you know, sometimes we look at things and think, wow, we've really come a long way. But then it's actually okay to say, and you know what? We could have asked for more, and we should ask for more the next time, and we should expect more the next time. How do we grapple with that? How do we think about sometimes when we're well-meaning and thinking we're doing good, we may actually be doing harm, and we have to reflect on what that means and whose lives we're, whose way of living we're accelerating and whose way of living we're not. But how do we think about bidirectional exchange, and how do we think about equity in the how we do this work, as well as equity as an outcome of what we do in this work? I found so many parts of today really inspiring and thought-provoking, thinking about wielding power to yielding power, thinking about practical things like pooled funding and indirect rates. So I feel like I, for one, will be reflecting on the conversations from today for quite a while. And I hope you all do too. And I hope you'll continue to engage with us in these types of conversations, because when we started the day, Dr. Walton brought us back to history and the history of colonialism. And we were reminded also during the day about current colonialism. But I think we also are ending the day with a positive note, and we have a chance to think about the future. And we all have a responsibility to shape that future. It's not just AI that is not a natural product. Global health is not a natural product. It is something that we can shape, that we should shape, that we all have a responsibility to shape. And the time to do it is now. And I wanted to quote one of my favorite poets, Seamus Heaney, an Irish poet, because some of his words always resonate and echo with me in one of his poems where he says, "History says, don't hope on this side of the grave. But then once in a lifetime, the longed-for tidal wave of justice can rise up, and hope and history rhyme." So I hope that we will shape the future, and I hope that we will focus on the problems that we've talked about today, but that are here to be solved. And I, for one, am really grateful to be part of this community and hope that we'll be able to at least try to make some efforts to solve them together. So thank you very much for being here. We can close out.